I was born the year the NHS was founded in 1948. It was founded with the aim of delivering care for everyone, not just for those that could afford the care.
It didn't matter if you were poor or rich, you had access to it.
For me personally, it means a free service for all people, and especially for people like my granddaughter Lucy.
And I would like to see it continue to be a national health service, not to end up as it was pre-1948, where only those who could afford good health care got good health care.
It was people-centred originally, and it was about providing service at a point of need, and I think that'll be dissipated if it gets to private companies.
The philosophy of the NHS is not that it's about people's means, but it's about people's needs. So to me, the more ethical thing to do is to deal with the whole population and make sure everybody's needs are met. And that's not done by profiteering.
Rather than be free at the point of contact, it's going to be more pound and pence driven rather than clinical care.
We went out to America and talked to hospital managers, and they were saying that because of their healthcare system, which again isn't like our NHS, they could only treat up to when the money ran out. And when the money ran out, the person was discharged, and it didn't matter if the treatment wasn't finished. And one lady actually said to us she discharged somebody onto a grating in the street because it was warm at least, and the staff would give them something to eat as they went out. I don't want that for our health service at all, and I think that's where we would go if it was all fragmented.
The general public need to be concerned again, because they don't realise what they're going to lose and what things might actually look like in the future. And I think that's a real concern, because it doesn't appear that, you know, anybody's really saying to them, you know, maybe you're going to have to pay more for things, maybe you're not going to get what you want. How do you get the care that you need? How can you be assured that, you know, when I'm in another 20 years' time and might be needing something, you know, am I going to get it? And I think that is a real concern.
Well, the general public managed to rise up and save the forest, and I really commend them for that, because they needed to do it. The general public should see that the NHS is every bit as important as those forests, and fight for it, because it's them that use it and need it and work in it. It's all of ours.
Even now, the general public don't think of the NHS as something to do with money. When they go to see the doctor or the OT or the physio. They don't see it as going somewhere where they're going to spend money to make them better. They're just going to be made better. Does that make sense? And I think that's where the cracks would come if they started seeing it as, well, I've got to go to the doctor and I don't know whether I'll be able to do anything because I don't know whether there's enough money in the pot. Right now we are still a national health service, and I think that if it once goes, there isn't a way back.